UK HealthCare Community Connection is sponsored by UK HealthCare.
In the latest UK Healthcare Community Connection, we are joined by the director of UK's Adult Congenital Heart Program, Dr. Andrew Leventhal.
He's here to talk about how UK treats adults who are born with heart defects. Thanks so much for being here this morning.
Thank you for having me. Good to be here.
Of course. So let's begin kind of with the definition of adult congenital heart disease.
So adult congenital heart disease, which is abbreviated ACHD, is the treatment of adult patients who are born with heart disease. Heart disease is actually the most common birth defect. Many of these patients present as children and they're treated by pediatric cardiology programs and have surgery. However, many of these patients are born with heart disease and they don't even know it, and their first presentation is as adults.
Well, why is it important to have an adult dedicated congenital heart specialist?
Because adult congenital heart disease is very different from adult cardiology, and it's also different from pediatric cardiology. I was trained first as an adult cardiologist before I did additional training in adult congenital heart disease, and I had very little exposure to congenital heart disease there. And pediatric cardiologists know a lot about congenital heart disease, but they're very focused on children, and adults with congenital heart disease are very different. They encounter different problems. And also the same problem in a 10-year-old may be treated differently from a 60-year-old.
Kind of going off the script here, because a lot of adults, you're saying maybe are just finding out that they have this. Is there like a symptom that they need to look out for? How do they know?
Well, you don't exactly know. So one of the things I like about adult congenital heart disease is it's very different. We see a lot of different diseases, so they can present very differently. But I would encourage people who are having chest pain, shortness of breath, or they're just not able to do the things that they used to be able to do, instead of immediately just saying, well, I'm just getting older, or I'm tired, or I'm busy, to have that checked out, because it could be a congenital heart defect.
Okay.
What sets the UK Congenital Heart Team apart from other facilities?
Well, in this area of the country, we are the only program that's accredited by the Adult Congenital Heart Association as of December 2024. And what that means is we have the staffing to provide comprehensive care. We're meeting national standards. And the reason we can do that is that University of Kentucky has so many different specialties, and the care of these patients requires multidisciplinary care. For instance, we need to have cardio-obstetrics, OBGYN doctors that are very familiar with congenital heart disease, because they're going to be treating these patients. We also have a psychiatrist on staff that helps us deal with some of the psychiatric difficulties that patients can encounter when they're diagnosed with congenital heart disease, or as they continue to deal with this lifelong process.
I love every single time UK healthcare comes in, they talk about how they meet these high standards. Brings a lot of level of comfort here.
I know, I love the fact that I live in Lexington.
Yes. We have some information on your screen right here about UK and their adult congenital heart disease, and all of the information there.
Dr. Leventhal, great having you in studio.
Thank you for having me.
We'll be right back after the break.